So I'm going to continue a little bit on trauma-informed care. Um, so that is when providers and other peoples are dealing with people who have trauma. Um, they need to be delicate and yet sometimes firm about how they handle trauma survivors. Um, a lot of times, what I recommend as a survivor is that a lot of us have information about things dealing with trauma and services or programs, therapy, all of those types of things. Um, so, what I suggest is that you gather things. If you're talking with them, if they're really uncomfortable, don't push it. Pushing things and pushing people to talk about things um, can be a sort of re-traumatization. Um, if they're ready, they're ready. If they're not, they're not. If they're bordering on the border, then they're maybe having enough effects from that trauma that they need to talk about it, or it's been a distance enough away from the trauma that they can talk about it, but do it gently. I'm all like, I'm talking about doctors, therapists, psychologists, psychiatrists, teachers, counselors, everybody who's like kind of first on the team as far as dealing with a lot of people on a day-to-day basis. So signs of trauma vary. 1 out of 4 from a traumatic experience develops PTSD, and the other 3 can usually process it in a way that does not develop PTSD. There is no guaranteed way to figure out who that 1 in 4 is going to be. The whole thing is that it depends on the type of experience, the person's personal foundation, their stability, their support system. It's a huge thing. I'm all like, I will say that categorically speaking, those who have PTSD are more likely to develop it from other experiences, because it can be a way of coping with something that saves your brain and saves yourself. That is something that develops automatically. My childhood sexual abuse contributed to later things happening that I wouldn't consider necessarily rape, but a sort of dissociation, acquiescence, a shutdown, a kind of system like lockdown, shut off, where you've got the 4. It's freeze, flight, fight, and faint. So there's the 4 responses to things, and sometimes certain experiences provoke certain responses, and other times, it's just, I'll say that my first consensual experience was when I was 19 years old, and it stopped after a few minutes because I was shutting down and the person was very, attentive to me and stopped. So it's like, it's just, if you're getting mixed messages from someone about, this is not trauma-informed care, this is more like dealing with a trauma survivor in a relationship, but if you're getting mixed messages about touching, or sexual contact, or things like that, it's time to pause, to step back, and to assess the situation in a way that has you sitting apart and talking about what just happened, because you can kind of tell, like, when someone, maybe does this or just starts, shutting off. It doesn't necessarily have anything to do with you, okay? It has things to do with previous experiences, and often traumatic ones, and some of them stem all the way from childhood. Some people don't remember some of those experiences. It's sometimes we block things, like I blocked things for 3 years. It's delicate. I'm like, people are delicate even if they're strong. When I talk about gathering information, and what I'm talking about is presenting someone with options and things and leaving it there for them to look at. Give them I know doctors' offices and stuff are busy, but when you're dealing with a trauma survivor, I'm all like, it's important that they might get some time to look at the information, maybe take some pictures of it, or select a few things that they want to take. This person is going to appreciate you, one, not counting what you put in there, not noting down what they took. Now, if they took all the information, marking down that someone took all the information, then they're probably fine with you knowing that they took it, okay? Maybe they'll talk about it the next time they see you. But if someone takes like one thing, I would not be marking that down, okay? That was a personal and private thing, and sometimes we're lucky that they took one thing at all. Because if that gets marked down and then it gets commented on next time by the same provider or even the next provider, this person knows that you are watching them like that. A lot of times we need some leeway to process some things and then come forward with them. If they confided to you in the first place about whatever, I'm all like, that's a huge thing. Don't break trust or break a relationship about that. I'm all like, when you're getting low on supplies, okay? Whether they're brochures or flyers or anything else. You do not need to keep exact count of every damn thing, okay? It makes me angry that, like, someone gets approached the next time that they're coming. Like, I saw that you took that blah 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 in the chart. What? Like, I didn't say that we didn't talk about that, and you right there have broke trust and now have probably shut down communication. You may shut them down from actually contacting who that brochure or whoever was about. Like, it's delicate, okay? I'm all like, I talk about it's just, people don't understand. I'm all like, I get that you want to help. I really do. And we need helpers. And we need helpers who understand. I'm all like, we need helpers who understand trauma-informed care, okay? We need people who are sensitive to the fact that talking about an experience, whatever it was, is difficult in the first place, okay? A lot of people, their first go-to is, it was my fault. You do not need a provider to be in your face about something that you took, okay? You also don't need someone to be pressuring you if you talk about an experience to get testing. That person already knows that they need to get tested, even if the person happened to wear a condom, all right? They're dealing with enough already that they don't need that pressure. You don't know if from that, they got pregnant. You don't know, like, anything. That first, like, admission or talking about something is also feeling you out and testing the waters, and to see how responsive you're going to be, how sensitive or caring you're going to be, if you take them seriously. And you always need to treat it like it's a serious matter, Um, Sometimes someone's posing a hypothetical, okay? But they might say that it's themselves. I'm all like, maybe they need the information for their best friend who refuses to come in because they heard about someone having a bad experience. So you writing things in people's charts and things like that, I'm all like, you don't know. I'm all like, it's just, I don't know. I'm all like, I'm disgusted with, so many things these days about these processes that re-traumatize people and make things harder. How many times did things happen to me that sent me screaming basically in my own head out of a counseling office? At least 3. I'm all like, that sent me away for years at a time. Years that I could have done healing, years that I could have moved forward. I'm all like, and was set back. I'm all like, if you don't know what you're freaking doing, I'm all like, then please don't. You can definitely speak from your own experience. That's allowed. I'm all like, how much you self-disclose is up to you. But even saying, my sister went through something similar. I had a hard time helping her. I'm all like, I took a, rape and sexual assault, class at a conference. I only know so much. I'm going to try and help the way that I can. I'm all like, putting that forward is telling the person what your experience level is, that maybe you don't have that much training or knowledge, but you're going to try your best to help them. I would rather you say that so that I can assess myself, my level of disclosure myself, my level of safety, and my level of knowing kind of where you're at, and therefore also not blaming you. If you tell me you have no training at all in that, then I know that, and I know that if I continue forward with whatever I'm saying, you might say the wrong thing. So survivors, I'm all like, don't necessarily blame the helpers. You can also blame yourself. I'm all like, if someone is disclosing that they have no whatever in this, then you need to say, you know what? Do you have any idea who does? Please refer me to someone who does, or who specializes in this, because I need help in that area, and I would rather not, have mishaps happen that could set me back. And if they're disclosing that, then they don't want to set you back. They want to help you, but they don't know how. Also, please try not to take it personally if someone who is a professional says, I don't have the skills or the know-how to help with your situation. They want you to get the best help that they possibly can. I'm all like, that means that they're hopefully doing research, they're contacting colleagues, they're trying to get you a list of names that you can interview people for, so that you can pick someone who is, fits kind of your personality and what you need to accomplish, along with what their skill levels are. And if you're with someone who makes you feel bad, it's time to leave. I'm all like, point blank. You do not have to settle. Period, end of story. I'm all like, there's online counseling now. There's all sorts of options. Do not settle for someone who is not meeting your needs or is making things worse. Okay? They may not know any better. They may. I'm all like, matching up a professional and a person who is coming into therapy is difficult work, and you often just get luck of the draw. I'm all like, which means if the person doesn't fit in that initial interview, I would say, and they're asking basic questions, but you have a list of questions too. I would like to know what your education is. Did you specialize in anything? How many years have you been doing this? Have you ever worked with people who have had these experiences? I'm all like, and if their answers don't really fit with what you're whatever, and maybe their personality does, still, I would assess asking for some colleagues' names. And if a person is adverse to giving you colleagues' names, that's a sign of something. Okay? So that's the bit for this moment. I'll be continuing on this. I'm all like, we can all learn from each other, and we can all grow from anything we've been through. I truly believe that. I'm all like, someone taught me a phrase called collateral beauty. Collateral beauty is the opposite of collateral damage. So if you think about, we'll say, a car accident. Okay, maybe not that severe of one, but the two people get out, they've got damage to their vehicles, you know, someone's at fault, blah, blah, blah. They exchange insurance numbers, whatever, but maybe during that talk and, you know, the police coming in and identifying the accident and everything else, maybe they develop a friendship. Maybe they go on a date. I'm all like, maybe someone discovers something that's really wrong with their vehicle that they didn't know about before that could have been a safety hazard, and done more damage on the highway or something. I'm all like, you never know what's going to happen. I'm all like, but instead of seeing the glass half empty, try seeing it half full.